Review Step 1 course. We're now going to cover the field of dermatopathology. Often Review Step 1 course. We're now going to cover the field of dermatopathology. In this section, we will cover general dermatopathology, including normal histology and normal terminology, infectious diseases, including viral, bacterial, and fungal elements, inflammatory diseases, and neoplasms, or growths of the skin. The normal histology of the skin is important to understand. There are layers and structures such as appendageal structures, hair shafts, eccrine glands, vessels, and nerves, which are important components of the skin. Terminology is critical to the study of dermatology. In dermatology, a diagnosis depends on macroscopic and microscopic morphology. Consequently, it is important to be very accurate and consistent with descriptive terms. Our first macroscopic descriptor is macule, which refers to a flat, circumscribed discoloration on the skin. If you can close your eyes, rub your hand over it, and not feel it, it is a macule. If you could close your eyes and feel it, it is not a macule. The second terminology macroscopic descriptor is papule. A papule is an elevated lesion of less than 1 centimeter in diameter. Coupling the two terms macule and papule, one can now understand what the term maculopapular refers to and what it does not. A nodule is a raised solid lesion of greater than 1 centimeter in diameter. This is to be distinguished from a plaque, which we will talk about in a moment. A plaque is a raised lesion with a flat top greater than 1 centimeter in diameter. A vesicle is a clear fluid-filled lesion less than 1 centimeter in diameter. It is distinguished from a pustule. A bulla is a clear fluid-filled lesion greater than 1 centimeter in diameter. And finally, a pustule is a raised lesion with purulent contents. One can see easily how to distinguish a vesicle from a pustule, and it is based upon the contents of the blistering process. A wheal is a pruritic raised lesion without scale, but with surrounding blanching and erythema. It is commonly referred to as a hive. Microscopic descriptors to be aware of include hyperkeratosis, which is an increased stratum corneum, orthokeratosis, which is an increased basket weave-like stratum corneum, parakeratosis, which is retention of nuclei into the stratum corneum, a layer that normally does not contain any nuclei, whereas acanthosis is hyperplasia of keratinocytes in the epidermis, leading to a thickening of the epidermis. Finally, acantholysis is loss of desmosomal connections between keratinocytes with rounding up of the cells. This concludes the section on terminology and normal histology.